Dr. H, nice to meet you. I'm Dr. Hefferon. How's it
Great.
going?
Good.
How's your day?
It was good. Went for a bike ride.
All right, well, good. Well, excited to help you with your knee issue, and I just got to ask you some questions.
Okay.
Based on your history with your knee and just your past medical history. It's going to just help me, just guide me with your treatment into what to do next. So, tell me a little bit about your knee and the history with that.
Kind of a long history. It's
Okay.
mostly my left knee.
Okay.
Been having a little bit of problems on my right, but more on my left. My main complaints probably now are like after I go hiking, it's kind of achy after
Okay.
that. I still have a hard time with like a single leg step up or step down. Like going downstairs is really pretty hard.
Okay.
And I kind of get like a little bit of like sharp pain, mostly medial, sometimes lateral.
Okay.
And it just kind of doesn't feel, almost feels like I grind over
Okay.
it when I go like down a step. So almost kind of do that like
Yeah.
quick step or kind of lean to my right side.
Okay. Backing up just a little bit, any specific injury that you had in the past, like walk me through that. I know it's been bothering, but like, do you remember a few instances where you injured it?
I mean, there's been quite a few. I've
Okay, we have time.
dislocated my patella.
Okay.
I think 6 dislocations and a few subluxations.
Oh wow. Coursing a span of like your kind of your
My
whole
first
life.
one was when I was 15.
Okay.
So I mean for a while.
For a long time. Yeah.
The last time I dislocated it was last fall.
Okay.
I was doing some manual treatment and
Okay.
I went to get up and
Oh.
I hit, we have a lever at impact and
Okay.
I hit the lever and it, hit my patella like just right.
Went out and came back in. So
No, Sarah came over and actually, like I told her to straighten my leg and so she straightened and put my
put it back in.
patella back in.
Okay.
Before that, the last time was I think the biggest time. Most of the time I would, have kind of I would say kind of a normal recovery, but when Natalie was born and I subluxed it or dislocated it, then it stayed out for, I don't know, what was it, like 4 hours?
Yeah. Mm-hmm.
But I avulsed that medial,
Patellofemoral ligament.
I avulsed the medial patellofemoral ligament, but there's a chunk of bone missing out of my patella on that side. So, and I think the recovery was just really hard because Natalie was 3 months old. I broke my hand, so it really wasn't in a lot of really good position. I feel like for really good rehab. I did do PT after that. And it helped. I just really never felt like I got really that strong on this side.
Okay. Any no surgeries, right?
No, we did do a surgical consult. I did a surgical consult in PT school when I was in PT school. So like in 2006. I can't remember why I did actually. I don't remember if do you remember? Did I dislocate it in PT school?
Maybe injured it. You kind of wanted to see, and they were talking about a J stroke and some of the,
Yeah, and then at that time it was that patellar relocation, so where they take the tibial tubercle and move it, and then they do a lateral release, and there's no good evidence on that. Actually, there's pretty poor evidence on that. So I think at that point I was like, no, that's okay.
Yeah. And
then after that accident with Natalie, so that's now 6 years ago.
Mm-hmm.
The ortho that we saw, I felt like was pretty honest and was like, there's 100 different surgeries that someone would tell you that we could do, but there's not one good one, and so I didn't do it.
Okay. Does your knee, just currently now, does it ever swell on you? Do you notice like after activity that it gets puffy?
So like if I play Jackson in basketball,
Okay.
I would say it gets a little
Okay.
Like puffy down into where my fat pad is. But not really.
Okay.
Like that, but that's like a lot of cutting.
Yeah.
You know, and I don't really, after hiking, I don't really get that.
Okay.
It's just more like if I go to step down off of something, it's more quick to get me.
Okay. And do you feel like it gives out on you, like when you go down the step, like it just like, ooh, like you gotta catch yourself, or?
I actually just feel like it's really sharp, like
so painful.
It's like a sharp pain, so I just kind of like get out.
Get out, okay. So going downstairs or down a hill?
Even up.
Oh, up, okay.
Up and down.
Up and down stairs will aggravate, give you that sharp, kind of get off of it quick.
Yeah.
Anything else, like a squat or a lunge or a step up?
You know, a squat actually has been bothering my right knee a little bit, but my left knee, body weight squat, not really. I feel okay with that.
Okay.
If I'm loaded, I think it depends on my activity the couple days before.
Okay, got it.
And so if I haven't done hiking or played ball with Jack or something like that, then I'm usually pretty okay to do like a back squat.
Okay.
When my leg is in the back with a lunge, I have to like really forcefully like tighten my quad up, or else again I get that like kind of sharp pain.
Okay. And you're saying the way you're describing is on the front side, right? Or more medial, lateral, both? You feel it sharp on both sides?
Yeah. You know, it's interesting though. You know, you got me the Peloton in February?
Yeah.
Like for Valentine's Day. So, my knee has gotten a lot better.
Sweet.
Like my leg's gotten a lot better. Like this, we used to call this my Nemo leg because it was just smaller.
Yeah.
And it's still smaller compared to this side, but I do feel a lot stronger than I have in a long time. So.
Okay, great.
So I think that's helping, but I would definitely, you know, really like to be able to do a step up and a step down. I think that's like
two big things. Yeah,
kind
be
of
able
like,
to hike and
I do like lifting. I really do, and so I feel like some of that is.
Okay.
So sometimes I still just do it and kind of like hoist myself up a little bit on the step up.
Any clicking, popping, or catching? I know you said sharp when you do those. Is it
it's
catch too, or is it kind of?
No catching.
No catching.
No catching.
Okay.
Just really grindy.
Grindy. Okay. Okay.
Yeah. No joint line stuff really, except because I do feel like the sharp pain's more.
Okay.
Like a little higher, is not really down into my joint line.
Okay. And then anything I need to be aware of up the stream or down the stream? Any hip issues as far as tightness in your hip or groin? Or?
You know, my left side, no.
Okay.
My right side, yeah. My right hip is really restricted. My right ankle, so I know when I had my injury that I had some really severe ankle sprains on my right side.
Okay.
I just kind of kept rolling.
Got it.
My ankle on my right side. I fractured my talus. Fractured it, dislocated it, you know, severed all the blood vessels and nerves to it when I was in 2000. And so I never really had full range of motion regained after that. So sometimes that feels, you know, in the morning it's stiff and takes a little bit of while to get warmed up that way, but I feel like that kind of cascades up to my right side, and then
may affect them. It might have an influence to the left side too.
Yep. And then I have scoliosis, and I have two C curves, and so I've always weight bared more on my right side really since I was an adolescent. I would say with all the injuries, it kind of became more predominant that I did that. And then when I became the director of rehab and then transitioning to academia, just sitting a little bit more, I'd say like more kind of tight on the right side in general. So. Okay,
that's good. The left ankle's pretty decent, the left side?
Yeah, left, good.
Good, and the left hip's
good.
Not bad. Okay, okay, good. Anything that you feel like besides the Peloton that really just helps you? Because you know, like you did some, you recovered from some of these injuries. Do you feel like consistent like strength training program?
Yeah, I feel like if I lift at least twice a week, it doesn't have to be much. Like I feel like I figured that out in the last couple of years. Is I can just I can do like a back squat, and I can do a few glute hamstring, glute med or proximal hip stability type of things, and
that's good.
That helps quite a bit. I think a combination, if I did the Peloton and then did probably booty yoga, I felt like when I was doing booty yoga that my ankle stability was better on my right side, so it was easier for me to do more just kind of multi-directional movements, and I wouldn't feel as much with my knee then either.
Okay.
So.
Okay, good. Tell me what your workout week looks like, maybe currently, and then what you wish it could be like. I know you said you ride the Peloton a couple times a week. You're trying to do a couple days of
I ride the
lifting.
Peloton now at least 5 days.
Okay, good.
So.
And then you lift 2.
I lift twice a week.
Okay, good.
Just kind of general total body. And then I would say a hike at least once a week, maybe twice a week.
Great.
Yeah, I think that's and
really
then
good.
Riding the bike in our quarantine time, we've been riding the bike outside quite a bit with the kids. So.
Okay, cool. Good.
Another thing is like I can't really jump on the trampoline. Like I'd like to be able to jump on the trampoline, but it's that like 15 degrees really kind of bothers my knee.
And it gives you that kind of that sharper type
it's
feel.
Sharp
that
pain.
same feel going up and down the stairs that you feel. Okay.
Yeah.
What about just general health besides orthopedic stuff? Anything I need to know about systemic diseases, autoimmune disorders, heart, lungs, like past medical history, pretty decent with?
I mean, I have a history of multiple episodes of pneumonia and been hospitalized several times for that. So, but I went through all the pulmonary testing.
Okay.
Like a year and a half ago, and my pulmonary function's really good, so
okay, good.
I feel pretty good with that.
Okay, great.
Yeah, great. So
anything else you feel like I need to know to help you?
Nope.
Okay, great.
Okay, great.